Hello, this is Harvey.Tettlebaum with Husch Blackwell. Husch Blackwell has been privileged to represent the Missouri Ambulance Association for many years. We are very happy to be able to present to you today a webinar, Navigating the Uncertainty of COVID-19, which will be a question and answer session responding to the questions that have been previously submitted to us. The presenter expert for this webinar is Eric.Weatherford. Eric.Weatherford is a partner in our Dallas, Texas office. He's the leader of the firm's healthcare regulatory and compliance consulting team. He advises healthcare providers nationwide on state and federal regulatory and operational issues, including requirements related to reimbursement, fraud and abuse, licensure, and other matters. Eric is especially well-versed in various programs involving government third-party payment and has become an expert in a very short period of time on the COVID-19 programs that the federal government has put in place in response to congressional acts.
Thanks, Harvey. This is Eric, and I'm happy to be with you all today. Just one quick disclaimer before we get started. This information is intended to be only general information in summary form on the CARES Act and the General Distribution Fund. The contents are not legal advice and shouldn't be relied on as such. The specific legal advice should be sought by in particular matters. And we've reviewed your questions submitted to the Missouri Ambulance Association and have combined them into similar topics to share answers with you today. So today we're talking about how to evaluate, allocate, and track the use of CARES Act relief payments. Now, at first I want to establish what this is. This is HHS funding. It's different than the Paycheck Protection Program. The PPP is an SBA loan that's designed to cover payroll costs. This is an HHS award, HHS being the Department of Health and Human Services. Before we get to your questions, I wanted to do a quick recap of the statutory authority we're discussing. So the CARES Act is, among other things, establishing a pool of $100 billion called the Public Health and Social Services Relief Fund, which HHS is distributing to providers. And for ease, I'm going to cut that long title and just call it the Relief Fund. Now, initially, HHS distributed $30 million from the Relief Fund, which they are calling the General Distribution Pool. And they distributed these dollars based on Medicare payments in 2019. And when they received these payments, providers had to agree to certain terms and conditions and attest that they would abide by them. Then, more recently, HHS distributed another $20 billion to providers. Some of those funds actually haven't been distributed yet, but quite a few of them have to providers that have submitted cost reports. And those funds have been distributed based on their relative net patient revenues. And again, you've got terms and conditions that providers must attest to, and there's an application process under the $20 billion fund. So there's also a little bit of a change in the terms and conditions. So we're going to talk about some of those. And it's not a big change. They're basically the same, but the change does relate to the application process that I mentioned. So we'll talk a little bit about that. But I want to talk about the terms and conditions as they relate to your questions. So we'll address them throughout this presentation and hopefully kind of iron out some of the confusing things that the terms and conditions present for the providers, including the uses of these funds. And that seems to be kind of a central theme that a lot of the questions had addressed. For example, what are healthcare-related expenses and lost revenues. So we'll be talking a lot about that. And overall, probably the biggest question we got is, what does it mean to prevent, prepare for, respond to coronavirus? And within that group of I guess, categories, what are healthcare-related expenses and lost revenues? So we'll talk about the fact that healthcare-related expenses are not defined, and we'll talk a little bit about the reporting requirements and documentation requirements. I will tell you that documentation is going to be all important here. You want to keep your expenses well documented, and in some cases, you're going to have to document in accordance with regulations that are established for HHS awards in the Code of Federal Regulations. So it's going to be really important for you to get with your auditors or consultants who help you with, with your accounting, to make sure you've gotten your expenses together and cost and really make sure that you complied with those things. And then we'll also talk about the definitions of lost revenue. So we'll go ahead and get started with the questions, but I did want to give that background before we address each of these specific items in turn. Okay, so the first question we have is, we have no COVID-19 expenses. Can we spend the funds on general communicable diseases equipment and supplies? And what's the time frame for spending these funds on such equipment and supplies? So you do not want to document that you're spending this money on general communicable diseases. You need to be able to certify that the payment you received will be used specifically to prevent, prepare for, and respond to coronavirus, and that the payment shall reimburse you for healthcare-related expenses or lost revenues. So in this case, you're talking about healthcare-related expenses, not lost revenues. But you need to ask yourself, if you're doing this, if you are buying this equipment and these supplies, are you buying this to prevent, prepare for, and respond to coronavirus? And if you're a healthcare entity, the likelihood is it is a healthcare-related expense. So if you can ask yourself that question, is this equipment being purchased to prevent, prepare for, and respond to coronavirus? And you can answer yes to that, then I think you're in a good position to be able to purchase that equipment. If you can't, and you can't document it as such, I think you're in a more risky position. As far as the time frame for spending the funds on equipment and supplies, or for spending the funds on anything, the feds have not prescribed one. But I would note that at some point there's a possibility that you would get audited. And at that time, if you haven't spent those funds and you have not allocated them to, say, lost revenue, you would probably have to give them back. So there's no exact time frame, but again, you may have an audit situation. Additionally, if any providers receive more than $150,000 in funds under the CARES Act, then you're going to have to submit reports to the Secretary of Health and Human Services within 10 days after the end of each calendar quarter, detailing the projects and activities for which you're using the funds. So that's in the terms and conditions. So if you're not spending them, you're not going to have anything to report. So that's a long-winded response to your question, I hope. The next question we have is, can we use relief funds to train staff on responding to communicable diseases? Again, are you preventing, preparing for, and responding to coronavirus? We don't have a definition of what that means. But if you are training on responding to communicable diseases, then I think you're arguably training on responding to coronavirus and preparing for coronavirus. So you maybe document the reasons you're doing this, and if you are doing this because of your response to coronavirus, then I think you've got a good argument for being able to include this as a healthcare-related cost or healthcare-related expense. You can also check the terms and conditions for the references to the HHS award sections on allowable costs, and they include the various categories of costs that are allowable, which may be helpful in determining whether these are allowable types of costs. Even if they aren't, though, you're making a good argument that these are healthcare related, you're a healthcare provider, you're training your workforce. Maybe if you're trying to put a belt and suspenders on the thing, you look for training sessions that are centered on coronavirus, and that'd really be ideal. But being able to document that you're doing this in response to or preparing for other outbreaks of coronavirus, I think would be helpful. Our next question is, if relief funds are used on extra time spent cleaning units, how should we document the added expense? As I mentioned, you need to maintain specific cost documentation. So if you mean that your people worked overtime, you would want to document that with overtime records. If you hired a company to clean the units, you'd want to document that. In any event, I would again keep close track of this just as if you were preparing for an audit. Again, I consider the terms of the HHS award requirements and the record keeping you have to do there. They're not crystal clear. We're asking for some guidance around some of them, one of which is that you have to get approval to buy certain equipment, which is a little bit odd. But with respect to cleaning units, we think that just documenting your cost, and if you have to include it as an allowable cost under the HHS award section, I would document it in accordance with those sections of the Code of Federal Regulations. Okay, our next question is, can you use the relief fund to cover or replace lost revenue? How do you provide proof and track your revenue losses as they relate to COVID-19? So here we do have clarity. You can definitely use relief fund to cover, replace lost revenue. You've got two categories. You've got healthcare related expenses and lost revenues attributable to coronavirus. So we can definitely use these funds to cover lost revenue. So let's talk about how we calculate our lost revenues. HHS has given us a little bit of a hint into how they're going to look at this. In their frequently asked questions that they issued in their response to the $20 billion fund that they sent out last week, they talk about the application process whereby a provider has to go in, and one of the things they have to enter is their lost revenue estimates for March and April. And they say that you can use any reasonable methodology and give two examples. For example, one of them is if you have a budget prepared without taking into account the impact of COVID-19, then the estimated lost revenue could be the difference between your budgeted revenue and the actual revenue. They also say that you could use your revenues from March and April of last year to March and April compared to March and April of this year. So assuming that the definition of lost revenues in the terms and conditions is the same as the definition that HHS is using in the frequently asked questions, I think that we've got some flexibility in how we estimate our lost revenue, but we know two things that HHS believes are acceptable methodologies. We've also had some clients ask whether they should track only their lost revenues for March and April, or whether they should look at the entire period of the national emergency. We recommend that while the portal requires only reporting of March and April estimates, that providers keep track of lost revenues for a period of time from as soon as you began experiencing losses till whenever that ends, but at least till the end of the national emergency. You want your lost revenue figures to be comprehensive, and the terms and conditions don't limit lost revenues to March and April losses. Our next question is, can we spend a portion of the money and return a portion of the unused funds? This is completely unclear. There's no mechanism in place that I'm aware of to do this. I'm sure HHS would be thrilled to get the money back, and if they audit you and you haven't spent all of the money or applied it to lost revenue, you'll have to pay back the difference, of course. But again, at this time, I don't know a way to return a portion of the unused funds. You can return all of the funds, but as far as returning a portion, I'm unaware of a way to do that at this time. So next, we've had employees out on quarantine and had to fill their scheduled shift. Can that money be used for that purpose? Can the money be used for that purpose? Absolutely. If you're incurring an additional cost of providing healthcare as a result of coronavirus, I think you can argue that it's a healthcare-related expense attributable to coronavirus, used to respond to the coronavirus. In this instance, a provider should keep detailed documentation showing that the scheduled shift changes were due to the quarantines of staff having been exposed to coronavirus. So there you're responding to it. The staff is a healthcare-related expense. And you are, if you have received more than $150,000, going to want to report that to the secretary in your quarterly report. So our next question is there a time limit of when the relief funds must be used? No, there's not a time limit, but again, if you haven't used or allocated them by the time you're audited, if you're audited, you'll have to pay them back. If you've got enough lost revenues to offset them, then it's no problem. But if you don't, then you'll want to identify healthcare-related expenses to use them for. Our next question is, as far as balance billing, our organization is out of network for insurance companies. How do we find out the in-network fees the insurance company uses, as each are different? Should we use the Medicare fee schedule for these kind of claims? Another good question without a completely clear answer. I would contact the patient's insurance company and ask what the in-network patient responsibility is for that program. I don't see why using a different fee schedule would be the answer. The terms and conditions don't say anything about how the insurance company will pay you. It just says you can't charge the patient more than the in-network out-of-pocket amount. So our last question is, upon accepting the relief funds, can we balance bill a patient that has the symptoms of a COVID-19 related patient but later test negative? The prohibition against balance billing patients is that you can't balance bill a presumptive or actual case of COVID-19. So the question is whether presumptive and a patient with the symptoms of COVID-19 who test negative are the same thing. The CDC defines a presumptive COVID-19 patient as a patient who tests positive at a local health department or at a lab that they do not confirm it by the CDC. So it's narrower than just someone who has the symptoms but later tests negative. I'm not positive that HHS really drilled down and got that technical when it made this definition, but since the CDC is an agency, I think that there's a good argument for billing this patient in the circumstances you're defining here. So those are all the questions we have for today. If you need other resources, we've got them on our website, and listed here at hushblackwell.com/coronavirus, also hushblackwell.com/cares.act, or -act, I should say. And if you need anything specific, we have an email mailbox at COVID-19 response@hushblackwell.com. This concludes our webinar for today. If you have any further questions, please feel free to reach out to Harvey or me. Thank you very much for your time.